When placed by an experienced surgeon and restored by a dentist or denturist that pays detailed attention to the bite, implant success rates are very high. Typical success rates range between 95 and 99% based on a large number of long-term studies, and my own experience confirms this. Other than the skill of the implant team, the success of the implant placement is influenced by a few other factors. When an implant is placed in bone, it is very dependent on both the quality and the quantity of the bone. Quality of bone refers to how dense the bone is. The more dense the bone is, the better implants seem to work. The lower jawbone tends to be more dense than the upper jawbone. Because of this, the success rate tends to be higher in the lower jaw than in the upper jaw. The quantity of bone has to be considered in all three dimensions: height, width, and depth. There has to be an adequate amount of bone in each of these dimensions to hold the implant. This is typically determined by x-rays. It is common to use a special three-dimensional x-ray called a tomogram because it can show the surgeon all three dimensions, where the standard x-ray will only show height and width. The tomogram is also very helpful in locating certain nerves and the sinuses. When the x-rays or tomograms show that there is inadequate bone volume, the periodontist can often increase the bone quantity by a variety of procedures. It should be noted that patient factors, such as smoking, can reduce these success rates.